The Ruba International Hospital, leader in the private health sector, is a reference for its quality, its cutting-edge technology, its vastly qualified professionals, and for their permanent dedication. The constant progress in medical and scientific research places the hospital at the forefront of healthcare, being recognized as one of the most significant centers in the Spanish hospital world. Ruba was created in 1943, and the Ruba International Hospital began working in 1984. The Ruba International Hospital is located in a residential area in the north of Madrid with easy access. It is formed by two buildings of 6 and 5 interrelated floors. It's provided with 13 central services, 39 medical surgical units, and more than 20,000 square meters occupy all the indispensable areas for an integral care of the patient. The hospital has more than 800 workers, doctors, nurses and auxiliaries, technicians and management, maintenance and security employees. The continuous provision of the most sophisticated and effective medical technology equipment offer an optimal level in healthcare. Biochemistry, microbiology and blood bank laboratories are integrated in laboratory and clinical analysis service, which are directed by hematologists and biologists. The area of diagnostic imaging is equipped with the most highly developed technology to perform all sorts of scans. It has several systems of high definition, 3 Tesla, 1.5 Tesla, magnetic resonance, helical CT with volumetric reconstruction of 16 and 64 detectors, and molecular image with nuclear medicine unit and PET-CT, among other techniques, which allow the diagnosis of tumors in their early stages. There is also a unit of non-invasive cardiovascular diagnosis conformed by radiologists and cardiologists, with extensive experience in coronary CT and cardiac magnetic resonance. Digestive endoscopy and bronchial and therapeutically diagnostic equipment are highly accurate, allowing to reduce surgical interventions. The pathology department consists of a multidisciplinary team of highly qualified professionals formed by pathologists and laboratory staff. The surgical area of the hospital has a sterilization room, an awaking area, and 10 operating rooms that count with the most modern technologies for surgery, such as microsurgery, endoscopic surgery, stereotactic surgery, and robotic surgery da Vinci, which operates under surgeon orders with pinpoint accuracy thanks to its 3D vision. Many of the interventions for which the laparoscopic approach is appropriate can be favorably done with Da Vinci robot. 2 operating rooms have specific devotion to cardiac surgery and ophthalmology with the best techniques for developing these specialities. The Ruba International Hospital offers the possibility of new ways of minimally invasive approach, much more comfortable for the patient and with a reduced hospital length of stay time, such as in traumatology, thoracic or vascular, among other surgeries. The surgical area is completed with a room of vascular interventional radiology and hemodynamic, equipped with the most sophisticated technology in all areas of its specialty. The neurology unit uses the latest diagnostic and therapeutic techniques. To be noted are programs for the study and treatment of epilepsy, sleep medicine disorders of memory and dementia, headaches, movement disorders, neuro-oncology, neuro-ophthalmology, and neurorehabilitation directed by professionals with specialized training in prestigious international centers. Furthermore, the obstetrics and gynecology and neonatology units located in the main floor and isolated from the rest of the hospital collect all the necessary services to cover any type of gynecological, obstetrical and neonatal pathology. It has 26 rooms, 2 delivery rooms, a specific operating room, in vitro fertilization and genetic medical laboratories. The neonatology unit has 12 posts of ICU and a separate area for children's intensive care. The family medicine unit makes a huge effort in the prevention and in the early diagnosis of diseases, coordinating medical checkup with a long experience of 29 years in this activity. When talking about the areas of cancer treatment, the Aruba International Hospital has been pioneer in Spain in the implementation for radiation therapy and radiosurgery systems. Brain gamma knife radiosurgery has been used at the hospital since 1993 and is currently working with its latest version, the Gamma Knife Perfection. In these last 20 years, about 6,000 treatments have been performed at the Aruba International Hospital with extraordinary results. It is a medical technique that, without surgical intervention, allows a very precise irradiation for treating brain lesions in a single session. It can be very effective in brain metastases, benign tumors, meningiomas and acoustic arteriovenous malformations, pituitary adenomas, and functional disorders as selected cases of epilepsy and trigeminal neuralgia. It's a procedure that only requires local anesthesia and a few hours of hospital admission. Other equipment for the treatment of tumors in any anatomic location is the CyberKnife robotic radiosurgery. Since Aruba International Hospital installed the first equipment in 2007 in Spain, more than 1,000 treatments with this system have been carried out in this center, presently being the hospital of greater experience in CyberKnife radiosurgery in this country. This system combines advances in radiation oncology with robotic developments, having attained excellence in radiotherapy treatments. It consists of a powerful linear accelerator mounted on a specific robotized arm, capable of moving around the patient while following the tumor's position. Designed to treat tumors, intracranial and extracranial, as head and neck, lung, pancreas, liver, prostate, bones and spine with sub-millimeter accuracy. In addition, the Aruba International Hospital has a complex system of radiotherapy treatment called Rapid Arc, capable of managing a session of radiation intensity modulated with excellent accuracy in only 2 minutes, minimizing side effects when radiating bodies next to the injury to a lesser extent, respecting the most healthy tissues. The Aruba International Hospital also offers other medical surgical units, in which pioneering techniques are applied, such as general digestive and laparoscopic surgery, angiology and vascular surgery, traumatology, general neurosurgery, ENT, spinal pathology, urology and andrology, anesthesia, reanimation and pain treatment, ICU and emergency, pediatric and cardiac surgery in children, and interventional cardiology surgery, child neurosurgery, and childhood trauma. But the Aruba International Hospital is not only synonymous of technology and innovation. To ensure the maximum comfort of the patient is considered a priority, which is clearly reflected in its 170 comfortable rooms, of which 18 are suites. The constant attention and dedication to the patient is mandatory, because above all, the main objective of everyone who works at the Aruba International Hospital is that the patient receives a personalized treatment.